Welcome back, guys. Today's topic is identifying and overcoming emotional detachment. Thanks again to Very Well Mind and Kendra Cherry for this awesome educational information that I'm using today. Emotional detachment refers to being disconnected or disengaged from the feelings of other people. This can involve an inability or an unwillingness to get involved in the emotional lives of other people. While this detachment may protect people from stress, hurt, and anxiety, it can also interfere with a person's psychological, social, and emotional well being. Emotional detachment can sometimes occur as a coping mechanism when people are faced with stressful or difficult situations. In other cases, it can be a symptom of a mental health condition. What are the signs of emotional detachment? There are a number of signs of symptoms of emotional detachment. These may include ambivalence toward others, avoiding people, situations, or activities, difficulty emphasizing with others, difficulty opening up to other people, feeling disconnected from other people, losing interest in people and activities, losing touch with people, not paying attention to other people, poor listening skills, preferring to be alone, problems forming and maintaining relationships, problems expressing your emotions, and struggling to feel positive emotions. Now, some of that can mimic depression, so be careful with that, okay? It is important, however, to remember that emotional detachment is not a mental health condition, but it might be a symptom of some mental disorders. Piggying back on what I just said, a lot of these symptoms can mimic depression. If you think you might be experiencing symptoms of emotional detachment, you should talk to a doctor or a mental health professional, such as myself. Such symptoms can be a response to an acute but temporary situation, or it may be a sign of a mental health condition. Your doctor will assess your symptoms, look at your health history, and evaluate your physical health to help rule out any medical conditions that might be contributing to your symptoms that you're experiencing. They will ask whether you have experienced recent changes in these areas and will want to know more about the impact these symptoms are having on your life and actually how long they have lasted. What causes emotional detachment? Emotional detachment can have many different causes. These can include past experiences and psychological conditions, but it can also be purposeful behavior that can be a way used to cope or set boundaries when you're in situations of stress or feeling overwhelmed. Some common causes of emotional detachment are listed as the following: your experiences. This could be past abuse, neglect, trauma. Children who grow up in abusive situations may use this detachment as a way to cope. In other cases, kids may develop attachment problems when there is abuse that contributes to problems with becoming emotionally attached and involved in the lives of other people. Next, mental health conditions. Emotional detachment can also be a symptom of a number of psychological conditions. These can include bipolar disorder, depression, I already said that one, disorders, and I captured that in another live and video, and post-traumatic stress disorder. I also captured that in a past video. Then there's medications. Emotional detachment can also be a side effect related to certain medications, including antidepressants, such as selective serotonin reuptake inhibitors. We call those in this world of our profession SSRIs. You should talk to your doctor if you begin to experience emotional detachment while taking your antidepressant. Your doctor may need to adjust your dosage or consider switching you to some type of different medication altogether. Emotional detachment can also be a problem associated with a substance use disorder. If you have symptoms of a substance problem and are experiencing emotional detachment, discuss your treatment options with your doctor. Then you have, lastly, voluntary behavior. In other cases, people detach emotionally as a way to cope with stress, establish boundaries, and reduce feelings of anxiety. This can sometimes be a positive coping mechanism in cases where you are facing a temporary problem. But it can become problematic if it becomes an overused pattern of behavior that affects your ability to form healthy relationships with other people. In some instances, emotionally detaching can help people protect from effects of traumatic experiences or episodes. You emotionally detach because you don't want to deal with the trauma or the tragedy, so to speak. Types of emotional detachments. This can include what we call reactive attachment disorder. This condition may emerge due to childhood abuse and neglect. As a result, children are unable to form healthy emotional bonds with their caregivers. Symptoms can include problems controlling and expressing their emotions. Then you have disinhibited social engagement disorder. This condition may occur when kids fail to form meaningful attachments with caregivers. Symptoms include being overly friendly and affectionate with strangers and showing little to no preference for their primary caregivers or family members. Now, I know you have the question of how do you fix emotional detachment. The treatment approach used to address emotional detachment depends on what exactly is causing it. Your doctor will evaluate your symptoms and may make a diagnosis that can help determine a treatment plan. If your symptoms are related to a mental health condition such as depression or PTSD or personality disorder, your doctor will likely recommend treating the condition to help relieve your symptoms. Treatments that your doctor may recommend could include psychotherapy, medications. Some psychotherapy approaches that might be utilized to treat emotional detachment include cognitive behavior therapy, one I use very often in this practice here, and acceptance and commitment therapy, formerly known as ACT. Cognitive behavior therapy addresses negative beliefs and maladaptive behaviors that contribute to emotional detachment. It helps people learn to cope with how they develop stronger emotional skills and without relying on detachment as a way to cope. ACT incorporates aspects of mindfulness. I love mindfulness, y'all. If you follow me, then you know I love mindfulness, relaxation, meditation, all those things, to help people become more aware of and in control of your emotions. That's basically what mindfulness is. It helps you just become aware of your emotions and helps you learn to control them more effectively. All right, let's talk about a little bit of coping. If you are experiencing emotional detachment that is causing problems in your life and relationships, there are things that you can do to help reintegrate your emotional connections in your life. These include, once again, practicing mindfulness. We just talked about that. Mindfulness is a technique that helps people focus on the present moment, including the physical environment and emotional responses. Learning how to engage in mindfulness can help you learn to pay attention to your emotions and build self-awareness. Next, we got strengthening your relationships. As you begin to build greater awareness of your own emotions, it is important to find ways to connect with safe people who will support your growth. Safe people who will support your growth. This is particularly true if your emotional detachment is a response to adverse relationships in your life. In other words, relationships that have gone bad. Finding ways to be emotionally vulnerable is next. Emotionally detached people can certainly love, but learning how to open themselves up to other persons emotionally is what takes the time. Surrounding yourself with safe people who understand your needs and are willing to give yourself the time you need can help you gradually work toward improving your emotional experiences and expressions. The key is get help now. Okay? If you feel you are dealing with emotional detachment, talk to your doctor. find you a therapist or a mental health professional that can help you work through emotional detachment. Okay? Lastly, keep in mind, emotional detachment can occur for a number of different reasons. When used voluntarily, it can help protect people from potentially traumatizing experiences. However, it may also occur due to the effects of trauma or as a symptom of mental health. If emotional detachment is negatively affecting your life and your ability to function, talk to a doctor or therapist. Treatments are available that can help you reconnect with your emotions and re engage with important areas of your life. Thank you for tuning in to the video on emotional detachment disorder. Please hit the like button and share the video for me if you will. If you are not subscribed to In the Safe Zone, please take the time to check me out and hit that sub button. You will definitely be glad that you did. Again, until the next video.